Have you ever noticed how after a certain age, let's say around 50, health problems seem to arrive not as isolated events, but almost like a chain reaction? Maybe it started with a routine checkup where you were told your blood pressure has crept up. Maybe you're given a tablet, told to keep an eye on it. Months or years pass by, and the next thing you know, your cholesterol is a bit high too. Another tablet, another box to tick. Then maybe it's your weight, your blood glucose, or a scan that shows fat around your liver. Suddenly, what started out as just one thing becomes a whole list: blood pressure, cholesterol, fatty liver, pre-diabetes, even type 2 diabetes. And before you know it, the prescription list is 10 items long. And I wonder, have you ever stopped to ask, why is this happening? Why is it that as we get older, these issues seem to line up one after the other, as if they're dominoes falling in a row? If you've ever felt like your body's quietly falling apart, or that you're just waiting for the next diagnosis, you're not alone. In fact, you are living the story of millions of people in the UK and around the world. There's so many people that feel like they're losing control of their health. I'm Dr. Nerys Frater. I'm an NHS GP and founder of the Lifestyle Clinic. I've spent nearly a decade running specialist clinics, helping people just like you, people of type 2 diabetes or pre-diabetes, or those that just want and need to lose weight, to get control without using medications. People often feel confused, frustrated, they're doing their best, but they feel like their bodies are letting them down. And if there's one thing I've learned, it's this: the way we've been taught to think about these health problems is all wrong. So let me take you into my world for a moment, because although I am a practicing GP and do prescribe loads of tablets, I'm also passionate about lifestyle medicine. I've seen it for years, week after week. I listen to people's stories. I see the frustration in their eyes as they tell me, I'm taking my tablets, I'm trying to eat better, but it just feels like every year there's something new. I hear the confusion when somebody says, I thought I was managing my cholesterol, but now my blood glucose is up. What am I doing wrong? And I see the worry, the sense of defeat, the quiet fear of what might come next. And I get it, because our healthcare system is set up to treat each problem as if it's separate. One guideline for blood pressure, another for cholesterol, another for diabetes. We hand out tablets, we run tests, we tick boxes. But what if I told you that all of these conditions, high blood pressure, high cholesterol, high blood sugar, fatty liver, are not unlinked, not random, not down to just bad luck or age? What if I told you they were all symptoms of the same underlying problem? That they're the body's way of waving a flag and saying, hey, something upstream needs your attention. So let's pause for a moment. I want you to really consider this. What if, instead of treating each as a different diagnosis, we started asking, what's the common thread here? What's the root cause? How would that change the way you think about your health? How would it change the way you live, the way you make decisions, the way you respond to each new challenge? I want to invite you to take a step back, to zoom out and see that bigger picture. Because the truth is, these random health patterns are not random at all. They are connected. They are the visible part of a much deeper story. And if we can learn to see that story, we can start to write a new ending. So let me give you an analogy, a different way to think about this. Imagine your health as a house, a place you've lived in and cared for many years. On the surface, everything might look fine. But over time, you start to notice little problems cropping up. A door that's sticking, a crack in the wall, maybe a window that's not closing properly, or a patch of damp in the hallway. And at first, each issue seems separate, something to patch up or repair. Maybe you call in a specialist for each one, joiner for the door, builder for the crack. But no matter how many repairs you make, another problem always seems to appear somewhere else. This is exactly how many of us experience our health as we get older. 1 year's blood pressure, next is cholesterol, then the blood glucose, perhaps even a diagnosis of diabetes. But each time it feels like a new and unrelated problem. So like a maintenance job. And the system is set up as doctors to treat each one separately. A tablet for blood pressure, a statin for cholesterol, maybe metformin for your blood glucose. But what if these problems are actually symptoms of a single issue, a fault in the very foundation of that house? In health, that faulty foundation is insulin resistance or metabolic syndrome. It's a weakness that runs beneath the surface, quietly shifting and settling over years, sometimes decades. You can't see it directly, but it puts strain on every part of that house. Depending on your family history, your lifestyle, and a bit of luck, the first sign might be a crack in the wall, high blood pressure. For someone else, it's that window that doesn't close, or cholesterol. A creaky floorboard, fatty liver. Do you see? Which problem shows up first can be random, almost like a game of chance. But if you only ever patch up the symptoms, you'll keep chasing problems from room to room, never truly feeling secure that things are sorted. And what I've learned from years of working with patients is that digging into the science, listening to real life stories, is that the key isn't to keep patching up each new crack. The real progress comes when you look beneath the surface and address the foundation itself. This is where my perspective as a doctor and as someone who's passionate about getting to the root cause starts to diverge from what you might have heard before. Because these conditions are linked. They're part of something far bigger called the metabolic syndrome. Now, I know that sounds like medical jargon, but bear with me because understanding this could change the way you approach health. So what is the metabolic syndrome? It's not a single disease. It's a name for a collection of risk factors that tend to show up together. If you have 3 or more of these, you're considered to have the metabolic syndrome. High blood pressure, high blood sugar, or a diagnosis of prediabetes or type 2 diabetes. High triglyceride, which is one of the readings from cholesterol, low HDL, which is the good cholesterol, and a larger waist circumference. On their own, each of these might be manageable, but together they paint a picture of a body under stress, or a body struggling to manage its energy, its hormones, and the balance. This is a problem of metabolism, and at the heart of it all is insulin resistance. This is the silent engine driving the whole process. It's when your cells stop responding properly to insulin, the hormone that helps sugar move out of your blood and into the cells for energy. When that system falters, your body compensates by producing more insulin, and over time, this leads to higher blood sugar, more fat stores around the organ, higher blood pressure, and changes to your cholesterol. It is not a coincidence that these problems show up together. They're all part of that same story. But here's the thing, most people have never heard of metabolic syndrome. Most doctors don't talk about it. Why? Because our system is set up to treat each problem separately. 1 tablet for blood pressure, another for cholesterol, a third for blood sugar, maybe a 4th. But what if I told you that by focusing on the root cause, just thinking about insulin resistance and metabolic syndrome, you could start to reverse the whole chain reaction? So with the house analogy, if you repaired the foundation, it could fix the problems and prevent new ones. That by changing the way you think about your health, you could shift from firefighting to prevention, from managing decline to building resilience. It is a game changer. We are living in a world that makes it hard to stay well. The body is simply doing its best to keep up. If we focus on patching up each new crack or fixing every sticking door, we're not going to get anywhere. We're not going to make the real impact as fixing that foundation would do. And I've seen it time and time again, as we address insulin resistance, blood pressure improves, cholesterol shifts, waist shrinks, and the blood glucose normalised. It isn't magic, it is science, and if you can apply it with compassion and understanding, you can really go a long way, and I can then help people stop medication. And this is what I want for you, not just another prescription, not just another diagnosis, but a whole new way of thinking about your health. So let me ask you, have you noticed the domino effect of one condition leading to the next and the next and the next in your own life? Have you ever wondered if there's a deeper reason why these problems keep lining up? And are you ready to stop firefighting and to start looking upstream? Because here's the truth, metabolic syndrome is not your fault. It's not inevitable either, and it's definitely not a life sentence. It's just a signal and a chance to pause, reflect, and to change direction. And the best news is that if you focus on the root cause, you improve all of these conditions at the same time. By addressing one thing, you could see improvements in blood pressure, cholesterol, blood sugar, waistline, weight, and energy all together. That's the power of looking upstream. Imagine if a tablet did all of that. We'd all jump at it. And if this is resonating with you, if you're starting to see those connections, the potential of what you can do, I want to invite you to join me for the rest of this mini-series. Over the next few videos, I'll be breaking down the science, the stories, and the practical steps you can take to reclaim your health, not by chasing symptoms, but by addressing the root cause. This series of video is free and open for everybody to watch. But I guess the main takeaway from this and my other videos is to point out you're not alone and you are not broken. You may even be at the beginning of a new chapter. Thank you.